We are pleased to have you all join us for this launch. May I just say that the I that I will be referencing in the next 3 minutes is Marcia speaking, not me. She wanted me to read her remarks. I also want to welcome you to the Worcester Recovery Center and Hospital. For many of you, it's the first time you're here. We're really very proud of this innovative facility. Before we start our program, I want to give a special thank you to the Children's Mental Health Campaign for their leadership. Members of the Children's Mental Health Campaign in the back. Could you please stand? Karen Darcy on your feet. Mary, thank you. It was the Children's Mental Health Campaign and their leadership that envisioned and championed Chapter 321, an act relative to children's mental health, which included the mandate for DMH to establish this Knowledge Center. We also thank legislative leaders, Representative Ellen Story, Ruth Balzer, and Jeffrey Sanchez, and Senators Jennifer Flanagan, Stephen Tolman, Richard Moore, and Harriet Chandler for their dedicated support of children's mental health in the Commonwealth. I'd like to acknowledge Senator Chandler, who was with us this morning. Senator, would you please? Thank you. Just by way of backdrop, and I will be brief, I want to tell you about Chapter 321. It established a broad three-part mission for the Knowledge Center. One, to ensure that the workforce of clinicians and direct care staff providing children's behavioral health services are highly skilled and well-trained. This goes beyond DMH. Two, that the services provided to children in the Commonwealth are cost-effective and evidence-based. And three, that the Commonwealth continues to develop and evaluate new models of service delivery. What's important about this mission is actually that it's clearly focused on the application of research knowledge and on the application of that knowledge to practice improvement work so that we can improve outcomes for our children, youth, and families. We view ourselves and this center as an intermediary organization, which means that it will facilitate connection among the rich array of children's behavioral health researchers, program developers, providers, practitioners, and consumer advocates in Massachusetts. And may I say, most of you are in this room. Connect research, policy, and practice, and connect to national leaders in innovation and best practice. Our commitment is to be strategic, to leverage and enhance other resources, and to disseminate best practices. The center is fortunate to have access to the Centers of Excellence at UMass and Beth Israel Deaconess Medical Center that DMH has funded for many years, as well as the terrific academic research institutions throughout the Commonwealth. We have representatives from both the BI Deaconess Medical Center and the UMass Center for Excellence here today, so thank you for coming. We're also fortunate to have partnerships with many of our organizations represented here today. Every year, DMH hosts a legislative breakfast series. This year, our theme was recovery. It starts with a conversation. We believe that sharing stories is a powerful tool in the recovery process. At all of our citizens' legislative breakfasts, we hear courageous and compelling personal stories of adults, youth, and families living with mental illness and thriving in the face of their challenges. The stories are all important, but the most moving ones are often those of our children, youth, and families who are meeting the challenges of serious emotional disturbance to mental illness every day. We need to talk more about behavioral health. The first signs of mental illness often occur in childhood. Half of all lifetime mental illness begins by age 14, and 3/4 by the time an individual is 24 years old. Adults with serious mental illness, on average, live 25 years less than individuals without behavioral health issues, in part due to troubling medical conditions, including smoking, obesity, substance abuse, and inadequate access to medical care. The Children's Behavioral Health Knowledge Center will be critical to our goal of interrupting the trajectory of mental illness early on. Within the broad mission established by Chapter 321, we intend to focus the center's efforts on prevention and early intervention across the developmental life stages of children and youth, across the levels of their behavioral health needs. There's an increasing amount of evidence and research on the importance of prevention. There are effective prevention and early intervention practices and programs, some of which you'll hear about this morning. Prevention and early intervention is a strategic, long-term need for healthcare reform, but one that doesn't get enough attention or investment. As we embark on the new wave of healthcare reform here in the Commonwealth, we will be talking more about behavioral health, its integration with primary care, and the importance of providing treatment interventions earlier. The Commonwealth's healthcare cost containment laws, Chapter 224, the Federal Affordable Health Care Act, and the implementation of parity all require attention to and investment in the quality and access to behavioral health care for children and youth. Chapter 224 is a cutting-edge, comprehensive law that's designed to bring healthcare spending in balance with the state's economy. It established a special task force to examine behavioral, substance abuse disorders, and mental health treatment, service delivery, integration of behavioral health with primary care, and behavioral substance use disorders and mental health reimbursement systems. The CBH Knowledge Center supported the Children's Behavioral Health Advisory Council, again, many of you members on that group, in developing recommendations to the task force on these issues as they relate to the health care of children and youth. Early intervention was the strongest theme. The Commonwealth has demonstrated its commitment to children's behavioral health services through its investment in the Children's Behavioral Health Initiative, and acknowledging several people, Jack Simons, who's the acting director of the Children's Behavioral Health Initiative, who's here today, and many of the providers in the room are a part of the implementation of that over the last 3-4 years. The CBH Knowledge Center will play an important role in all of this work. So, Marcia, thank you for those comments. They're most relevant, and I think they really do underscore the importance of healthcare reform as it relates to improved behavioral health delivery systems, which has been so much of her focus and our focus over the last year or so. So now I'm going to speak. So we're pleased, DMH is very pleased to announce that our new Knowledge Center has established an annual symposium and commemorative lecture in honor of Gail Ann Ray. Gail Ann was a leading voice for children's mental health for over 3 decades until her death just 2 short years ago. As a children's mental health advocate, she was on the cutting edge of raising issues and corralling stakeholders from the public, private, and volunteer sectors to focus energy on solutions. Gail Ann chaired the Professional Advisory Committee on Child and Adolescent Mental Health for over 20 years and had a role and a voice and a stake in every budget increase and every positive policy initiative impacting children's mental health. Many of our colleagues from the Professional Advisory Committee are here today in honor of Gail Ann. Her cause was prevention and early identification and intervention. Let's get in early. Let's have a conversation about our capacity to change the lives of our children, youth, and families. Gail Ann's deep commitment to improving the lives of children, working across organizational and disciplinary boundaries, bringing practitioner voices to research and using research to inform policy and practice, has anchored this initiative for which you're here today and aligned it with her values. We are happy to acknowledge her, honor her, and build her into the infrastructure of our education going forward. It's appropriate that our keynote speaker this morning will be talking about the power of conversations and the power of prevention. There could be no better person to have speak at this lecture dedicated to Gail Ann. Dr. William Beardsley directs the Bear Prevention Initiatives at Boston Children's Hospital. He's a senior research scientist at the Judge Baker Children's Center and the Gardner Monks Professor of Child Psychiatry at Harvard Medical School. Bill's long-standing research interest has really centered on the development of children at risk because of parental adversity, such as mental illness or poverty. His work is focused on the ways in which self and shared understanding help individuals and families cope with adversity. His early work described civil rights workers and how they endured and significantly changed the South. He studied resilience in survivors of cancer and in children of depressed parents. This led to the development of effective public health interventions for families facing depression and a 10-year randomized trial that showed that they were safe and led to lasting gain. In this country, and I say in this country because Bill is well known nationally, internationally, and has done significant work in other parts of the world, but here, he and his colleagues adapted the principles in a teacher training and empowerment program for use in Head Start and Early Head Start called Family Connections. He directs the Boston site of a multi-site study on the prevention of depression in adolescents using Greg Clark's cognitive behavioral model. This work has demonstrated sustained preventive effects for more than 32 months after enrollment. He's the author of over 200 scientific articles and 2 books, The Way Out Must Lead Us, Life Histories in the Civil Rights Movement, and Out of the Darkened Room, When a Parent is Depressed, Protecting the Children and Strengthening the Family. He served on 2 Institutes of Medicine committees, one dealing with the prevention of mental illness in children, youth, and families, and the other dealing with parental depression. He co-chairs the IOM's Forum on the Dissemination and Implementation of Evidence-Based Prevention and Treatments. Dr. Beardsley is on the board of the Rosalind Carter Mental Health Task Force, Mental Health America, and Families for Depression Awareness. He served on 2 Institute of Medicine committees, one on the prevention of mental disorders, the other on exploring the impacts of parental depression. He serves on the Behavioral Health Commission that advises DMH about children's issues. Bill, thank you for being a friend to the department and for your willingness to share with us your extraordinary gift and knowledge this morning.